Hi students. This is a digestive assessment. So the first part is we're going to have the person describe what they're experiencing and we'll list the qualities. The second part in a different video will be the 24-hour diet evaluation, and then we'll tally up all the qualities and of their nutritional intake. Then we'll do a third part, which is where we take the information and think of herbs and foods that will help balance out what they're experiencing. So this is super oversimplified just to get you the idea and the information flow. So the lady that we're talking about is 67 years old, and she is saying she has irritable bowel syndrome, and that's what she's been diagnosed. So the first thing you do is you take that diagnosis and you set it gently to one side and say, describe what you're experiencing, please. So she says, well, in the past month, I've been very constipated and feeling very bloated. We will give her a dry right there for constipation, but you'd also need her to describe what that is. She says, well, the little rocks, and they're dark brown, and it's really hard. I have to really push and work hard in order to have a bowel movement, and that's like every 4 days maybe. So we're also going to give her something in here like a possible deficiency of water. She says, yes, I've been working outside a lot in the garden in the last month and not drinking enough water. So yes. Then the bloating, say more about that. What happens with that? Well, I just feel like my belly is really kind of big and squishy, and I feel like when I eat stuff, it just sits there and it doesn't go anywhere. So something in the lines of a not enough digestive fire would be indicated by that, and a deficiency there too. I'll say, well, how long has this been going on? Well, just this past month when it got really hot outside. But really it happens kind of like every year, a few times a year. So we have a surface phenomenon that's happening because of the hot weather, but she says it's been going on for quite a number of years, a few times a year. And so this indicates that there's some underlying issue going on. And so that's just a very simplified version of what you ask somebody to get them to describe what they're going through, and then you evaluate the qualities of their imbalance. So the next video will be the 24-hour diet snapshot. We're going to ask her everything she eats and drinks in a day and some other pertinent questions. Come back later.